Hometown Radio, 1580 KGAF presents the Community Service Report. Here is Dee Blanton.
Well, here we go again, another community service program here on this Thursday morning, Muenster Memorial Hospital Day. And as usual, very happy to have our friend, the CEO of Muenster Memorial Hospital, Brian Roland, with us. Hi, Brian.
Hey, Dee, it's great to be back with the Kid Craddock of Cook County here.
Oh, please. If I only had his money. Anyway, this is kind of a special time, I guess, for the hospital and for you, because you're coming up on an anniversary. You've been there 3 years as the CEO now, and let's kind of talk back and kind of review some things and some accomplishments over the last 3 years, and maybe look ahead at what the next 2 or 3 years might bring.
Yeah, it's really amazing when you think about it. July 15th will be 3 years, and the time has really flown by. There's been a lot of stuff we've done, and first of all, it starts with having a great team. We've got, again, and I talk about this all the time, some of the greatest nurses. The staff that we have there are second to none, the quality, and so it is truly a team effort. But I think one of the things that really has helped over the last 3 years is I feel that the board has a good understanding of what we're doing. They have an understanding of what I'm trying to do, and I think that plays a very important role in moving the hospital forward and continuing to grow. And so to me, that is probably one of the most positive things that have happened over the last 3 years is their comfort level with the changes that we're making, because there are some things that I do that sound a little crazy and that are kind of out there. And then getting the staff to understand why we're doing some of those things. And while you're doing that, bringing on the new physician, bringing on Dr. Crow-Rodney, I think has been very beneficial for our facility. When you look at adding her to the current providers that we had there, I think we continue to move forward with the care that we're giving. While we've always given great quality care, and our patient satisfaction has always been very, very good, I think we continue to grow that. And those are some of the easy things to look at. But then when you add in there the specialty clinic that we added with the grant, yes, we had a cardiologist there, but he was practicing in the clinic, and it was kind of hard to get his patients in there. With that specialty clinic, now we have a couple of cardiologists. We have the orthopedic surgeon that comes over. We're working on more docs. And so that, I think, is a feather in our cap. You look at the respiratory department, getting that added, that in itself in the last year has helped our revenue by more than $300,000. And that's very, very positive, not only for our revenue enhancement, which we've increased our revenue each year over the last 3 years, but for the care that we can give our patients, because that is our top priority, and being able to add that service, not just from an inpatient standpoint, but from the respiratory therapy that we're doing on the outpatient side. And so again, people don't have to leave Muenster for their care. And so when you look at all of those things, you look at the room renovations, I think that's one of the biggest things. And we're in the middle of doing that now. But when we're done with this project here in the next, hopefully 60 days, we're going to have only 2 semi-private rooms, and the rest will all be private. And most of those are going to be on the lakeside. So not only are you getting great health care, you're going to have it with $1 million view. Mm-hmm. And so I think that helps. So, and even for our staff, they went a long time without getting raises. We've been able to, we're going on the 3rd year of being able to do raises for our staff. And this year, their cost of the health insurance isn't going up. And trying to find good health insurance these days is a struggle that's cost effective. And then our healthcare foundation. Getting that up and going. And again, we still have a ways to go with that, but getting the tax ID number and working on those. So there is just a lot of stuff. I mean, we've got 120 employees at our hospital, and it takes all of us to keep us going. And where we are today from where we were 3 years ago, I feel a whole lot more comfortable. As the CEO of the hospital, I think about this every night when I go home, is if I mess up, if I screw up, if I do something wrong, it's going to cost 120 people a job. And what is it going to do to Muenster? And this team that we have there are really moving forward. And as we look forward, Jimmy Dean said, I can't change the direction of the wind, but I can adjust my sails to always reach my destination. And when you deal in healthcare, you gotta be able to change. As we look forward, our goal is, the next 3 years are going to be crazy with reimbursement. Medicare is cutting programs. And how do you deal with that? How do you not go to the taxpayers and ask for more money? And that's my ultimate goal in the next 3 years, is not to be dependent on the taxpayers for our operations. We truly want to use those funds to grow the hospital, but not pay for the day-to-day. And part of that is looking at the doctors in the specialty clinic. Look, getting people to utilize the services that we currently have and the equipment, which we are updating a lot of the equipment that we currently have, and make sure we're getting the biggest bang for our buck out of the equipment, and really stressing the why go anywhere else mentality in Muenster and the surrounding areas, and then really looking closely over the next couple of years at our mission, our vision, our values, and making sure that those statements that we follow, that we are staying where we need to be and we're moving forward with those. And I think the other side of that is we also need to make sure that we're working on employee satisfaction, because while you can have great patient satisfaction and you can have wonderful provider satisfaction, if your employees aren't happy, then it doesn't really matter what you do in outside. You're never going to get to where you need to be. So I think that's one of the things that we need to continue to focus on, and that's always a tough one. Patients, we provide a great service, and people can see that. Our doctors do a great job. Our outcomes are very well. But when you're dealing with employee satisfaction, that's always how do you make 120 people happy? If I knew the answer to that, I probably wouldn't be here, but
some of us have trouble making 3 people happy.
Yes, yes, and for me it's 2. But for me, and so for us, it's, and as we prepare for the future, and I know you always want to say you don't want to look too far down, but in a couple of years we've got a couple of new providers coming on board, and I think we need to start preparing today for what the game plan is going to be when they get here. Because the potential influx of patients and what we hope we're going to be able to do, you don't want to be sitting around twiddling your thumbs going, well, we need to do this, this, and this. We need to do these things now. And so it's one of those things where the last 3 years, it's been change. And the next 3 years, while things are moving in the right direction, you're still going to have change. And unfortunately, I still remember my first day in healthcare 26 years ago when I was working for the state of Texas, and they had you raise your hand, and if you didn't like change, they wanted you to raise your hand. And 3 people raised their hands and got let go. And because change happens every day. George Bernard Shaw said, progress is impossible without change, and those who cannot change their minds cannot change anything. And if you work in healthcare, you've got to be ready for change. And good, bad, or indifferent. Bad things that change in healthcare may be better for us down the road. We still don't know what's going to happen with the affordable healthcare. We don't know what the legislative folks are going to do this next year. When we hit January and all of that hits again, programs that we have now that may go away or may change. I don't think reimbursement will ever get better. I don't think somebody will ever show up and say, hey, we want to just give you more money. And so we've got to be prepared, change. And that's what's going to be happening over the next 3 years also. And
of course, change means adjustment for those 120 employees too. Everybody's got to kind of suck up and adjust when the change happens.
Well, and my goal is that we'll do it in the right way, and we'll communicate it the right way so everybody knows what's going on as we move forward.
Right. Very, very good. Well, happy anniversary number 3, and I hope 3 years from now we're still visiting on Thursdays. How's
Perfect.
that?
Well, I appreciate it. Thanks, kid.
You bet. All right. Thank you very much. Brian Roland, he is the CEO of Muenster Memorial Hospital, and that's going to wrap it up for our community service program today. here on Hometown Radio, KGAF.